Today is National Breast Reconstruction Awareness Day, better known as BRA Day. The acronym for that, it's observed every year on the third Wednesday in October during Breast Cancer Awareness Month. Its purpose is to educate patients and the public about breast reconstruction options after a mastectomy or lumpectomy. The observance also celebrates the strength and resilience of breast cancer survivors. According to the American Society of Plastic Surgeons, only 23% of women understand the full range of breast reconstruction options that are available to them following a mastectomy, and fewer than 20% elect to undergo immediate reconstruction. And joining us now is Dr. Stephanie Nemir from the Infusion Center Boutique. Dr. Nemir is the Secretary of Medical Staff over at UMC. She's also the Chief of Plastic and Reconstructive Surgery at Texas Tech Health, El Paso. Dr. Nemir, first of all, thank you for joining us today. I mentioned at the top there that women don't always know the full range of breast reconstruction options that are available to them. Many also don't realize that they have options that are close to home here in El Paso. Tell us a little bit about what those options are.
Absolutely, and thank you so much for having me on here to talk about this, because as you said, it's very important for patients to understand what their options are. So if you look at national statistics, less than 50% of women who receive a breast cancer diagnosis are referred to a plastic surgeon to discuss what their reconstructive options are. We're really fortunate here in El Paso that we are able to provide a full range of reconstructive options. That includes partial breast reconstruction in the case of lumpectomies, up to complete reconstruction using either implants or a patient's own tissues from elsewhere on their body. It's, I think, very important for our population to know that you don't have to leave town to have these types of reconstructive options.
And the decision to undergo a mastectomy is a difficult one for women who have been, not only who have been diagnosed with breast cancer, but there's also some patients who have a genetic predisposition to breast cancer but don't actually have cancer but want to be proactive about their situation, choosing to give up their breast to reduce the risk. We're talking about deeply and profound decisions that aren't taken lightly. They're both a physical toll as well as a mental one too. What do you tell your patients who are thinking about this and going through this?
I like to tell my patients that they're facing something that is challenging, but that it's a marathon, not a sprint, and we're running it together. And so the goal is to get them across the finish line and get them on to the rest of their lives. And reconstructing the breast can be a really important part of that, because by performing breast reconstruction, you're able to give a woman a little bit back of what cancer has taken away. And so I have those conversations with patients, and I emphasize also that breast reconstruction may not be the best option for everyone. I think my role is to really educate women on what the options are, and that includes the options for immediate reconstruction or even reconstruction years after the fact, so that they can decide what the best option is for them and their life.
And of course, October is National Breast Cancer Awareness Month, and the statistics, unfortunately, become an all too common occurrence for women across the country. You had shared with us earlier that 1 in 8 women will have breast cancer, meaning we've all likely been touched by this diagnosis in some way, shape, or form. Early detection, always important when it comes to a cancer diagnosis, but especially with breast cancer. Why is that?
Well, the earlier that you catch a breast cancer, the more options you have in terms of the ways that we can do both the treatment of the cancer itself as well as any reconstructive options. And if a cancer is caught early, and many times you do not have to undergo any chemo or radiation or other types of what we call adjuvant or neoadjuvant therapies, or other therapies that also help to treat the cancer in addition to surgery. And so for patients who may be nervous about undergoing a mammogram, and I have had a mammogram and I completely understand the nerves, but thinking about the fact that this gives you a chance to take control over your health and to really have the best possible outcomes in the case that they do find something, or to give you some peace of mind in the case that the mammogram comes back clear.
And who should be getting mammograms, and how often should you be getting them? And I guess also what resources are available to those who maybe don't have the means to get a mammogram?
So the guidelines currently state that women should start being offered mammograms at age 40, and those are typically done yearly. Sometimes for women who have particularly dense breast tissue, they may be offered additional types of imaging in addition to mammograms. And for patients who have a genetic predisposition to cancer or who have first-degree relatives with cancer, the recommendations may be to start even earlier. So it's important for women to speak to their physician to try to find out what the recommendations are in their particular case. We're very excited here at University Medical Center to be able to offer reduced cost screening mammograms for patients who are uninsured. It's important to note that insurance typically will cover mammograms, but we know that not everyone in our community has insurance, and so it's important to know also that the options available for them. And in the month of October, you can call any of the University Medical Center or UMC facilities, the clinics, or the main hospital here and get scheduled for a mammogram without a referral from your doctor. And so that kind of takes one of those steps out of it for the patients, which I think makes it a little bit easier for them to get it done. And while I'm speaking about insurance coverage, I think it's also very important for patients to know that since 1998, which is when the Women's Cancer Rights Act was passed, all insurance companies that cover breast cancer care have to also cover post-mastectomy reconstruction. And so I think a lot of women are afraid that this is something that would be cosmetic or something they would have to pay out of pocket for. And this is typically something that's covered by their insurance, even years after the fact.
And one more time, again, October, of course, is Breast Cancer Awareness Month. I'm curious, though, from your standpoint and your position, we see a lot of support for this movement in the month of October. And a big one, there's sports teams or sports leagues like the NFL who have all their players who are wearing pink in the month of October. We see messages that are displayed in the end zones that are supporting. Is this impactful in terms of maybe meaningful support and trying to create more awareness in the communities?
I think it absolutely is. As you mentioned, 1 in 8 women will face a breast cancer diagnosis in their life. And so that means pretty much everyone knows someone or will know someone who's dealing with this. And raising that awareness and demystifying it, I think, really gives us an opportunity to destigmatize something that's a very, very common cancer, and also to help us to work together as a community to support people who are going through this, not just in October, but all 12 months of the year.
Dr. Nemir, thank you so much for your insight on a really important topic for today. Also a really important topic for the month of October. We certainly appreciate your work and everything you're doing for the community.
Well, I appreciate you giving us this chance to get the word out on breast reconstruction and your time this evening. Thank you much.
Absolutely. Dr. Stephanie Nemir, the Secretary of Medical Staff over there at UMC.